senior member of our team. And John, in fact, has been with WellNet, just celebrated his 10-year anniversary, and is a senior vice president of business development with us, and just a great colleague. So looking forward to his passion and his feedback. And then we're also joined by Doug Hetherington. Doug is the CEO of Health to Business. And Doug is one of our business partners, and we thought he would also be just a great person to be part of this subject and part of this conversation today. So before we get started, Doug, how about take a 60-second commercial and tell us a little bit about Health to Business and who you are and what you do, and a little bit about your background, so that sets the stage for everyone.
Yeah, Dave, appreciate the opportunity. So Doug Hetherington, 20-year advisor. I'm from the Southern Idaho area, smaller employers, second generation in this business. And it was probably, 10, 12 years ago when I started scratching my head and kept scratching, as you can see, and ultimately really became very skeptical about our industry. And that kind of set me on another path, and through some just fantastic experiences and relationships and influence, I found myself at some point, very deep in the cost containment world, working with, captives, reference-based pricing. But then I also found myself squarely in front of both healthcare providers and administrators. And instead of looking at them from an adversarial standpoint, really started to view them as really potentially the solution to a lot of the inefficiencies in healthcare. And it was through those experiences and then the development of some community-based health plans that we really began to understand what it meant to kind of solve some of these challenges within healthcare. So as opposed to just doing that on the retail basis as an advisor, we then kind of started Health to Business, myself and several partners, both providers and clients, as well as industry influencers. And we started Health to Business as a way to go into communities where, in essence, where there's a desire, a will between both, let's say, the advisor and the vendor community, but then also the provider community. We help them build community-based programs to where they can work with one another to, in essence, strengthen healthcare for the benefit of the community. And now we're even starting to connect those communities in kind of a web type fashion across the country. So Health to Business is certainly a unique organization. We tend to think of ourselves as direct contract administration is really the primary role that we serve, but certainly that means a lot. So it's an exciting world that we play in, and certainly happy to be partnered up with WellNet, who we think has a fantastic strategy towards getting employers to that kind of community-owned health plan panacea, if you will. So happy to be here.
Thanks, Doug. That's awesome. Yeah, and Doug, we're just happy to have you here today, and certainly glad that we're business partners with you. So as we go in the discussion today, we're going to get a little, we may offend some of you, but we're going to do it in a friendly way. And so what we're really trying to do is just make sure that you walk away thinking differently about how you're approaching conversations. So John and I and Doug and Megan pulled together some scenarios that we're hearing from brokers and consultants and advisors that we work with every single day. And so what we're going to encourage you to do is, when you hear these scenarios, don't be that broker. Just think differently and don't do the things that we're going to talk about today. Because we're also going to give you ideas to think differently when you might have this as part of what you're saying or doing today. And you know what? Also, when you hear some of these things, we know that sometimes you're placed in this position where you're developing a proposal and you're getting ready to present it to your client. And the facts that are in front of you, you might want to just think about the facts and how you present those. And so we're going to give you some ideas and thoughts about how you might approach those conversations differently, as opposed to just what you might say today. So here's some of the scenarios. The first scenario that we hear oftentimes, that your client received a low or high renewal increase. And the way the broker might say that to us is, well, Blue Cross, they came back with, an 8% increase or renewal, and it's just too good to pass up. Don't be that broker. Second scenario is, the consultant is selling solely on price. And so it might sound something like this. You know what? I'll suggest, John, that they meet with you if your maximum costs are lower than the renewal. Or it might be, your administrative costs are higher than the competition. Or it might be, your fixed costs are the highest on my spreadsheet, John. Don't be that broker. Scenario 3, your client does not feel like they are ready for self-funding, or they just have a fear that the change may be just too great for them. And so it might sound something like this. I talked to my client about going self-funding, and they are just not ready this year. Or it might sound something like, my client has been fully insured and they're afraid of the risk if they go self-funded. Don't be that broker. And then the fourth scenario might be something like this. You know what? This year, we've got a lot of high cost claimants or shock claimants. And so really don't think it's a good year this year. That happens. And we understand that, but don't be that broker. So let's talk about these things. Let's jump into it and talk about the very first scenario. So your client received a low or high renewal increase. Maybe it's 5%, maybe it's no increase, maybe it's 10, 15%. You're seeing these things today. And it could be from a carrier, could be from your administrator, could be an ASO from a carrier. But this is what you're hearing. So let's jump right in there. John and Doug, when you hear the first thing about, yeah, I've got this much of an increase, I don't know if I'm going to be able to do anything this year. What's your reaction? What's your thoughts? John, how about you kick us off?
Sure. So, I think first and foremost, I'd like to say the price should never, ever be the first reason an employer considers a self-funded strategy. Self-funding is just that, as Doug already mentioned, it's a strategy. It's how you use the strategy that will dictate your future price. Think of self-funding like a business plan for your benefits plan. Every high-performing business has a business plan, and every high-performing health, medical and prescription plan has a strategy, a plan in place. The year your fully insured plan is running well is the year every single stop-loss carrier is going to want to bid on your business. The stop-loss market will offer your clients in that year the strongest pricing that you're ever going to see. To say that a different way, you wouldn't shop for your homeowner's insurance when your house is on fire. You wouldn't shop for car insurance when your car's wrapped around a telephone pole. And you shouldn't only shop for stop loss when your plan's running poorly. So it needs to be reframed. I think one of the biggest common themes you're going to see across these four scenarios is that price is often the leading conversation piece when discussing self-funding, but it shouldn't be. It should be last. The strategy is most important. That's what employers deserve to understand.
Yeah, John, I couldn't agree more. I mean, I think my first reaction to it was this is a reaction, and I think that's a significant flaw of. And Dave, you used the term brokers. I think over the last several years, as I've kind of transitioned into this more of a wholesale world, being a vendor and working with brokers, I've gotten to know them better than when I was competing with them. It's a different perspective, certainly. And I've kind of drawn up four different categories. And it may be a little bit harsh, but I think for everybody on here today, you need to take a hard look in the mirror and kind of decide which category am I in. The first one I'll just say is an agent. And I doubt many people on this call fall into that category. That's your guys going out and schlepping the fully insured policy. So if you're here today, you're probably going to fall into one of the next three categories. I'm going to say the next one is broker. And I think that's the experience that we just heard in this question, which is somebody that's operating off of a spreadsheet. And the reality is that's not strategic in nature. It's a total reaction to what has happened, not which direction we actually want to go. The next category that I would put is in consultant. And I would say these people have the ability to start to slightly get off the page, establish those strategies, and kind of walk their clients through a little bit of an education process, but they fall short in one area. They default back to the spreadsheet. The moment that renewal shows up, it doesn't matter what we talked about throughout the year, the renewal now dictates the process. And that leads us to your fourth, which is leaders. And that's probably a lot of you on the call today. And I know that for myself, it hit me probably about 5 or 6 years ago. It was a probably 50, 60 man group. I think I had that 7-8% renewal that I'm like, okay, I know I can sell this. And I said, I'm not going to talk about these things. I'm not going to talk about cost containment. I'm not going to talk about strategy. I'm just going to go renew it because my team was tired of everything I was building. 2 hours later, I walked in the office and I said, here you go. The group wants to move. They're ready to do it. I couldn't help it. Even on an 8% renewal, they were suffering. It wasn't okay for them. Their business couldn't take that any longer. And it was in that moment, I knew it was my job to lead them to the solution that they chose. It doesn't mean I tell them what to do. It means that I show them every option they have. And when they begin to solidify a strategy, I am going to lead them through that. That is the person that gets off the spreadsheet and makes the difference and doesn't allow a renewal to then dictate everything that happens from there on forward.
Wow, Doug, I love that. I've actually not heard that kind of description and definition before of those 4 categories, but I love that. That's great. And so if you think about advisor, what does that mean? It's advice. And so what you're really trying to do is provide informed information and advice for someone to be able to make the right decision that's in the best interest of the plan. So I love those 4 categories. That was cool. So well, let us pause right there. Anybody have any thoughts, questions, reactions to what you've heard so far? It's okay if you haven't. Do you see anything, Megan?
I'm looking to see if there are any raised hands. You guys can also contribute in the chat too, and I can call on you. Nathan has a 100 sign. 100% agree. Awesome. All right. So I think people are leaning in.
Some leaders out there. That's great.
That's awesome. That's wonderful. All right. So look, okay, let's take it a little further then. And let's now talk about that second scenario. The second scenario is when the consultant is selling solely on price. John kind of hinted to that a little earlier. And honestly, I just got an email from one of my business development team members this morning and said, this broker came back to him and responded, hey, I'm sorry, but your fixed costs are the highest on the spreadsheet. So unfortunately, I'm not going to be able to present you tomorrow. When we hear that, it just blows our mind because somehow they just missed it. They missed the value of the discussions and what we're trying to do to drive down the cost of healthcare and create a better experience for the employee. So Doug, what about you? When you hear that kind of response, what do you think?
First and foremost, I'm going to go there. You're on the spreadsheet first and foremost, and that is not going to dictate 2 things, price or experience, right? The spreadsheet is purely a reflection of what we think it's going to cost to manage this plan. But let's face it, folks, 80% of that is claims. So is that what we're actually talking about when we discuss price? And I think that that's the other side of it, is that if you're focused on a spreadsheet and you're spending all of your time in the admin and in your premiums, you're doing a disservice to your clients. You're getting them focused in the wrong areas. You're never going to spreadsheet yourself into normalized trend. It doesn't happen. The game is rigged, right? So you actually have to get in there and work the process. So when we start talking about price, I immediately think unit cost. Right? What is my cost of managing this? And certainly I can look over at, maybe a larger carrier, ASO, whatever it is, that's willing to put a price on a piece of paper that may or may not be accurate, right? It may be gimmicky. They may be robbing Peter to pay Paul, but that's all part of the discussion that you need to be having with your client. It's experience at the end of the day is what this is really all about. Because I can tell you right now, I've seen plans that are $5 less expensive than another, where the experience is horrible on that plan compared to the $5 more expensive plan. And it's because the one that was a little more expensive focused more on the strategy and the experience for their plan members than they ever did on the price that showed up on the spreadsheet. So really, candidly, it's very likely a disservice to that client that a WellNet or a TPA like yourself didn't even make it, they're in a finalist. It's a disservice to that group.
Oh, wow, Doug, that was awesome. John, what's your reaction to that? What's your thoughts?
The thought I wrote down in preparation for today's call was spreadsheets work for commodities. Fully insured plans are commodities in a sense. I mean, they're very similar in every capacity, no matter who you're using. Self-funded plans, even with the carriers, are different. But then when you introduce an independent TPA, it's like trying to spreadsheet an Apple and an automobile. They're not even in the same realm of similarity. And so, just as an example, I'll throw out a few things here. As a TPA, WellNet tries to build plans with our consultants and our clients that offer 0 deductibles for members, offer 0 copays for many high-cost medications. None of the mainstream national carriers are doing that. That alone is worth more administrative fees. The ability to attract and retain top talent by offering a significantly differentiated health plan is worth more. I always ask when I get questions like this, what's the actual dollar amount that we're talking about? Doug just used $5. What is it on an annual basis? Is it 25 grand? Is it 50 grand? If we source one medication in a more efficient way through an assistance program, through international mail order, it wipes out that whole difference. If we redirect one major surgery to a direct contract, like Doug mentioned earlier, it wipes out the whole difference. If we quote on the stop loss, you're going to see an independent TPA, because of their cost containment controls, is going to have lower stop loss premiums, lower maximum claims. So the higher administrative fees in a self-insured environment with an independent TPA, you should be thrilled about, because they're going to impact the 80% of the costs that Doug was referring to. Plus the stop loss premium is going to be impacted as well. So it's so short-sighted to focus purely on the fixed costs. If you go back, some of us have been doing this a long time. If you go back 15, 20 years, sure, talk about fixed costs and talk about discounts, because that's all that existed, even though that's not true. But today there's so much at your fingertips that a focus on fixed costs is so short-sighted. There's so much opportunity today to attack that 80%, that's where you have to learn, you have to educate, so that you can sit in front of a client and say, look at all these ways that you can build a strategy around your health plan.
That's so great, because in fact, I talked to an advisor this morning, and in that conversation, they said, you know what, we don't focus on the price and we don't spreadsheet like you described, Dave. We're focused on the total cost of care. And so I like that, because that's now wrapping it all together. Because oftentimes, if you look at just the administrative cost of administering the plan, it's 5 to 7% of the overall cost. When you then throw stop loss and other fixed cost into it, it may be 10, 15% of the cost. But, John and Doug, you hit it. What we're really trying to affect is that 85%. And that's the claims under the medical and the pharmacy plan. And if that's where you're focused, then you can really drive a difference. If you're focused on the administrative cost and, hey, can you come down $5 on your medical and admin fee? Hey, can you drop this for $3? And if you do, then you'll be the lowest on our spreadsheet and you'll win. That's not what we want to accomplish.
I have found that with a lot of these employers that do have leaders as advisors, right, as their consultant, they kind of, once they get through that initial phase of breaking away from, we call it the status quo, but they're in this new world of cost containment. What I have found often is that the CFOs and CEOs kind of start to get it. At first, they may try to manage a nickel and dime the cost, and you kind of remind them, you're not sure what you're messing with here. You think you're going to save a couple of bucks. This is going to cost you in the long run. And most of our clients, we find 3-4 years into it, CFO and CEO have kind of walked away from it and just said, to your point, they're starting to look at it as total cost and just say, okay, HR, just keep making it work. And I noticed a comment here from Dan Malin, right? And he mentions the long term. And I think that's what we've got to be focused on, that if we're looking at a spreadsheet, we're dealing in 12-month increments at best. And if we're going to get off that and really start to get a different vision, you have to look at it holistically to say, what does this experience not just need to look like in this 12 months, but how are we going to continue to manage that experience moving forward? And so we have actually found that working and identifying your vendor partners and working with them hard has become a much more effective way of delivering on that fantastic experience versus spreadsheeting every year and thinking that we're going to, price our way into that better experience. It just doesn't happen.
It's important to remember that when you're quoting self-funding in the first year, more often than not, the data that you're giving the market is terrible. There's not much detail. It's coming from a mainstream carrier who doesn't want to give you what you need because they know why you need it. And so the data that you're giving the market isn't very good. And so you shouldn't expect, there shouldn't be an expectation that in the first year, on a spreadsheet, you're going to see big savings, but that has nothing to do with the actual performance of the plan. The spreadsheet process in that scenario in the first year is just to make sure that the downside risk is acceptable to the client. That should be the very last thing that you talk about. The rest of the conversation is about strategy. How do we build this plan in such a way to all but guarantee that we don't come anywhere close to that maximum cost? There's so many ways, and we don't have time for it on this call, but to attack the cost of claims so that you operate 20, 30% under that maximum cost. And I'm talking about PPO-based plans, not radical ideas like reference-based pricing. It just, you have to get together and strategize as a team, the consultant, the TPA, the employer. They need to be in the same room having a conversation about what's possible. And then you'll realize that certain slippers fit certain clients, certain other ideas fit other clients. But there's all kinds of strategies that can be used to make sure that these self-funded plans run well, both in the short, mid, and long term.
So I've got something that I want to share with you because it just popped into my head. And I thought about, I spent a little bit of time in the financial services area and was a consultant for wealthy people and for people running 401k plans. And there's this thing in the financial advisor world called the rule of 72. The rule of 72 is kind of cool. It just simply says, if you take your return and you divide it into 72, that's the number of years it takes for your investment to double. Okay. So if, as an example, you're getting a 6% return on your money, then it takes 12 years for your money to double. If you're getting a 12% return on your money, then it takes 6 years for your money to double. So now think about that in healthcare, because this just kind of popped into my head. So if you're getting a 12% increase every year for the last 6 years, the cost of your healthcare just doubled in 6 years. And so that means that's what your trend line looks like. And is that the right thing in the best interest of your client? No, because clients of self-funded TPAs like WellNet that focus on building and optimizing smarter self-funded plans, our trend lines look like this and like this. And that's what we should be focused on, not this. And don't even think about the rule of 72, because if you are, that's the wrong focus. And advisors don't focus on the rule of 72. Had to just go there for a second to give you just a correlation to think about. So
claims drive renewals. Whether you're fully insured or self-funded, fully insured's pooled, self-funded's not in the sense we're talking about it, but ultimately claims drive renewals. So if you want to control the trend, as Dave just talked about, you got to control the claims. Figure out how to control the claims. There's tons of ways to do it.
Agreed. So Megan, I see a number of questions coming in and comments and stuff like that. So what do you think we should try to address that you've seen so far?
Yeah, I think a lot of people are just kind of echoing what you're saying and adding their input. If somebody would like to come on and talk live, that would be great to liven the discussion. But if you want to remain in the chat, that's great. Does anyone want to contribute? I know, Trevor's been active in the chat. We've got Bob. So don't be shy. You can unmute yourself. Ethan, do you have anything to add?
Sorry, I was just reading a question on here from, oh gosh, I'm scrolling back up. It looks like Bob. Bob asked a question, what's the realistic size that fits this type of product based on number of insured lives? And also, what's a typical ending cost compared to the maximum? Meaning, I would think to clarify that, how does the plan run typically compared to max?
Great. John, you want to go there?
Sure. Across our book of business, we just looked at that in the last year, and it's 77% is our statistic. So when you see a maximum cost come out of WellNet on a spreadsheet or on our rate sheet, if you will, our average client is running at 77% when all is said.
And another thing that we just looked at recently as well, which I thought was also pleasing, is to see that our average cost per employee per year is $7,000. That's almost half of what the average per employee per year cost would be as measured by the Kaiser Family Foundation surveys they do on an annual basis. So that's significant. I also saw someone ask if we're going to talk about our cost containment solutions today. you know what, if time permits us to do that, we will. But we want to make sure we spend enough time on these 4 scenarios to equip everybody for how to handle the discussion. So thanks for all the feedback and support so far. I like all the thumbs and thumbs up and clapping and all of that.
Yeah, Dave, there's actually a great comment from Craig Lack. Too many are conditioned to reflexively direct the employer's attention to fixed costs, which misses the opportunity to discuss strategies to be in a position to improve quality and experience for all parties. And I think that's well said and sums up what y'all were talking about in that portion.
So Doug said something in kind of our green room when we were talking, and I love it. I've not heard it before. So let me make sure I say it correctly, Doug. You can't spreadsheet your way into a better experience. Did I say that right?
Correct.
And I love that. So think about that the next time you're about to go into that spreadsheet, and now you meet with your client and you're talking about your spreadsheet and that's all you're focused on. Trust me, if you act as an advisor and you talk about reducing cost with good strategies and making sure that the member experience is better than they have today, at the end of the day, most employers are going to applaud you for bringing an idea to them that makes it better for their employees and their families, and also can reduce their 3rd largest business expense on their balance sheet. And if you reduce that 3rd largest business expense, you're increasing the profitability of the company. And then what can that company do with their profitability? I like saying this. This is one of my favorite things. If you think about, and this is just a fact, that Starbucks, who we all like Starbucks. I know Megan likes Starbucks. She oftentimes talks about it every day. So if you like Starbucks, so Starbucks spends more on healthcare than they do on coffee beans. General Motors spends more on healthcare than they do on steel. So think about your employer and what are their business expenses, and bring to them a strategy. And it's a strategy that's focused on reducing the 3rd largest business expense in their company. I'm not talking about healthcare, but just say 3rd largest business expense in your company. And if I could deliver you a strategy to do that and increase the profitability of your company, is that something that you would be interested in? Most of them will say yes.
Well said.
Thank you.
You know,
I
heard
brought up Trevor. Oh, John, I'm so sorry. Go ahead. And then
That's okay.
we did bring up Trevor to spotlight. If Trevor wants to get in on the conversation, Trevor, you're in the bullpen.
All right, so I'll just say this real quick. Yesterday, a consultant said to me, Benefits 101 is about protecting an employee's paycheck. And yet the only tool the mainstream carriers give you to control price is to hurt the employee's paycheck by shifting cost. So the conversations we're talking about today, where I've started to spend all my time in meetings at the beginning anyway, is talking about how to enhance the members' experience, reduce their costs, protect their paycheck. That's what's possible when you have these types of dialogues. You don't have to use that only tool that the mainstream carriers give you. There's so many other ways. Hit it, Trevor.
All right. Well, I was going to say that I'm too shy to come on camera, but those that know me know that's not the case. So I just want to echo some of the things, but also I spent almost 10 years at an independent TPA and I had so many of these conversations every renewal season about, you'd go out and try to get 25 cents per employee per month and you get beat up on it. And it was like, man, we're talking about 0.001% of total health plan spend. Like, I don't understand why I can't get 25 cents because I need to give my team raises and, cost of business is going up and all those things. So I just always wondered, I don't want to hammer the brokers in the room because there's a lot of great ones out there. But I just wondered if there was like a broker school that everyone went to that was like, that if you're self-funding and the TPA admin fee is going up, you just ratchet them back down and that's all you focus on, because it seemed like every year was like that. And most people that get into healthcare and health benefits have an interesting story. Like, they didn't go to school to say, I want to be a benefits broker or consultant. So I really like that we're taking the focus away. The fixed costs are important, right? It's not like we can just throw them away, but it's a piece and a part of your overall strategy. And we're talking about healthcare. When you have a self-funded plan, you're talking about healthcare and how that drives the financing of healthcare. When you're working in a fully insured model or just focusing on fixed costs and letting the claims do what they do, then you're just doing health insurance. And I don't think anyone just wants to do health insurance. Like, the people that you're serving are individuals and they need benefits. And one of my first clients ever said, it's an employee benefit. Don't forget the benefit part of it. It shouldn't just be, like John said, another premium increase. And what's frustrating sometimes in the market is you hear or see that, oh, there's no other options. Like, this is, your only option is to take this 4% and increase deductibles. That's not true. There's options all over the market. Sometimes it can be hard to, find them or compare them, but there's a lot of great, smart people out there that can help you. And there's a lot of advisors that do this that you can call on too, that are happy to help. So anyway, that's all I got for today.
Thank you, Trevor.
Awesome. Good stuff, Trevor. You
And we
actually
got
overthrew
another
your
Trevor.
shots.
Sorry, Dave. We brought on Trevor Baker too. He raised his hand to get in on the action.
Yeah, thanks, Megan. One thought I just keep thinking of is we talk about leadership and we talk about consulting and bringing true value. And I think more and more that I have learned and embedded myself into this industry, the key is being humble and truly getting out of the way at times. If there's ways that we can just bring high quality talent to the table, and we are that tool in the toolbox that the employer has picked up and said, I need this tool to solve this first problem, but then that tool leads over to the provider for some reason, being at the table with someone, there is such good value to that. Just yesterday, I had an experience with an advisor where they were saying, I would rather the employer not talk to a provider about maybe working directly because I want it all to go through me. And I said, okay, that's great. But I thought, what a missed opportunity where a hospital administrator was willing to sit down at the table and say, I am willing to help be part of this solution. And so as advisors, I keep thinking, and anyone in the industry for that matter, if we can find a way to be humble and realize we are not the only tool in the toolbox, but a valuable one, where we can work together with others and bring a lot of talent and ideas to the table, suddenly a consultant becomes a true leader. And that business isn't just there for 1 or 2, maybe 3, 5 years. It's there forever. And truly, at the end of the day, the value that the initial tool had, it might not have been the screwdriver that fixed the problem, but the screwdriver maybe it enabled the business owner to think, I can use another thing along with this to make it even more powerful. So just a thought, as we all become leaders together, as we kind of get out of the way at times and are humble in a way that we think that, yeah, there are greater solutions and I'm going to be a part of this solution, not a part of the problem, and get out of the way sometimes, there's a really big benefit to that.
Trevor, thanks for that. That's great advice, great thoughts. And I also believe there's a lot to be said about not only being humble and kind, but it's also about being humble, genuine, and authentic in whatever you're doing and whatever you're presenting. And that's the kinds of things that really employers are just looking for. Can I trust you? And if you're those things, they know that they can. So let's move on to scenario number 3. And so that one is, we hear oftentimes, and it's, you know what? I talked with my client about going self-funded and they're just not ready this year. Or, you know what? My client has been fully insured forever and they're just really not comfortable going self-funded. And so if you think about that, that is all based in fear. And so fear prevents us from doing a lot of things in life. In fact, we're so proud of Trevor because Trevor overcame his fear to put his camera on and talk to us earlier. But fear is a big reason why people won't make changes, both in life and certainly within the healthcare arena. And so, Doug and John, let's talk about that. How, when you hear that, they're just not ready for self-funded this year.
Yeah.
What do you think about that? How do you respond to that?
John, you take that. Go first.
My first reaction, if I hear that after I've quoted, is what in the world did you ask me for a quote for? Did you really just talk about self-funding with your client for the first time after we quoted it? What are we doing? It's like this whole conversation. Your client needs to understand what self-funding is. Why would you waste the whole industry's time putting together a spreadsheet? And I'm sorry I'm saying this so fervently right now, but honestly, your client shouldn't be making a decision on self-funding because of some price you throw on a spreadsheet. Have conversations with your client off anniversary about different strategies, captives, self-funding, independent TPAs, ASO with the national carriers. Those are great value adds as a consultant. That's what your client's paying you for in some capacity. And then if the client says, I really like this idea, still don't quote, find yourself 2 or 3 TPA partners and let those TPA partners come in and talk strategy to the company. Let the company decide which strategy they like the best, and then work together with that TPA to put together a strong proposal. To tie this together, when that happens, we go to our stop loss carriers and say, man, we got a done deal here. All you got to do is come close to this price. And then it's easy. The alternative is you flood stop loss carriers with quote requests and they don't take any of them seriously because they know half of them are going to come back with this silly excuse. And so in my own experience, having been working for an independent TPA 17 years, do your clients the service of education in advance of quoting, because these are the 2 single worst things you can tell a partner, because you might as well say, I wasted your time completely and I'll do it again next week. I'm going to send you 2 more quote requests.
Yeah, no doubt. That's tough. And you know, I'm gonna cut a little slack to our advisor friends out here, having been guilty of it myself in the past, right? If I think way back when I first got into this business, we are conditioned to behave a certain way in the benefit side. And let's face it, I mean, especially with the passage of health reform, we are locked on January 1. I think about it. I mean, we talk about Q4, like, you know, we're going to battle every year. My favorite term is next year, right? And if there was anything that advisors would take away from this call, next year starts today. So when I started adjusting off of the Q4 cycle, and I didn't wait till August or September to really do anything. I mean, I may have been prospecting and stuff, but as far as my existing clients were going, I wasn't really doing anything. I was just paying attention. What are the new products in the market? Is there something new, bright, shiny? I can take them so they think I'm doing something for them. I had no strategy whatsoever. And it was when I got off that everything changed. And what I realized is that it's painful right now. The pain is fresh. And if you walk into a group that had, yeah, we're just going to kick this can down to the next year, but it was painful, the wound is still open. It's a perfect time to begin to identifying why they want to avoid that pain. And so it starts today. You got to get out there right now. You got to start meeting with not only your clients, but your prospective clients. And don't be afraid to walk away, right? If you've got a group that's perfectly candid with just kicking the can down the road, and that's not the type of leader you are, you're not a good fit for them. Move on, right? And that's the other thing. I see brokers like anybody can be my clients. I started walking in about 5 years ago, and I flat out would start every meeting the same way. And I would say, if you think I'm here to ask for a BOR to take over your whatever name it BUCA plan, I do not want it. I do not take broker of records. If you work with me, it's because you are committed to cost containment. Within 1 hour, we're probably going to figure out whether or not we're a good fit or not. I mean, that was it. That was the value prop on the front end. I didn't want to waste my time any more than anybody else did. So if they're not a good fit, don't work them. But start today. It's got to start now. And candidly, you should be making your vendor introductions in the spring, making your decisions in early summer, committing to all of your vendors. And who cares what the price is, to the point. Sometimes it's going to be high. Sometimes it's going to be low. If you have a strategy going into it, you will be successful, period.
Yeah, that's
Wise
great.
word.
Good thoughts. Good thoughts. Megan, any reactions or thoughts or comments that you're seeing? Seeing a lot of comments today. Thanks, everyone. Oh, you're on mute.
You're awake.
Take 2. Yeah, chat's full of activity. So I think this question was directed, as John was kind of talking about the education process before spreadsheeting and quoting. What information do you need to begin that process before even getting to numbers? What does that look like?
conversation, right? I mean, is the group committed to this? And if so, well, then set up a call, right? And I always, this is getting back to, it seems like the number is going to dictate the process, and that's not it. The strategy should dictate the process. So where I would suggest is that the advisor spend a little time, whether it's WellNet or some other vendor, get to know them a little bit, understand what it is that they bring to the table that is unique, and then bring that to your client with them. Don't try to sell a WellNet or some other solution on your own. Have them be accountable for it. We have to remember that we're walking away from a spreadsheeting process to where the client can make a decision off of a piece of paper. But when you start talking strategy and that they're now going to be accountable and a self-funded employer, they need to know who their partners are. It is no longer your job as the broker to be the gatekeeper. You're the trusted advisor that's leading them. Help them develop relationships with their trusted vendors. And ultimately, that experience side, not only will it resonate at the member level, but it will now resonate at the administrative level. Your clients will begin to think that you walk on water because it's no longer just you, but rather an arsenal of some of the most brilliant people in the self-funded industry that candidly run circles around anybody in the fully insured world. So bring them to the table. It's a team sell at the end of the day.
That's great stuff, Doug. In fact, one of the things that we have at the top of our list when we're talking to prospects and companies that might have an interest, we typically ask our advisors that we work with, let me ask you a question. What's this client's readiness for change? And they'll say, what do you mean? So if they're presented a strategy that makes sense for their company, are they ready and willing to make a change? And oftentimes that question is not even asked. And so if you're not asking that question, I would encourage you to start asking that question, because then you're not going to waste your time. You're going to know that at least you've set an entree and an appetizer to think about what the future might look like if they considered an alternate business strategy. So any additional thoughts before we move on to scenario number 4? All right, so scenario number 4. That's going back to where, and this is something pretty common, and we understand why this one is said, because it's true. I just talked to a consultant today who said, we've got a plan, and it's in Ohio, and right now they've got 7 to 8 claimants that are all over $125,000, and their costs have gone up about 12% every year. And so we're concerned whether we can take them self-funded because they have so many high cost claimants or people that are exceeding the specific or exceeding the pooling point. And so let's talk about that, because I think this is something that's a little bit more self-funding 102 or 201 that people might need some guidance on. So how do you respond, Doug, to that kind of question or that kind of thought about why self-funding self-funding may not make sense?
Yeah, like you, I've got an Ohio example and a Nashville example, and one of them is actually, well, both of them specifically are with you all. And I think to your point, this is maybe a 200 level, but I think it goes along well with the theme that we've had today, which is kind of get off the spreadsheet. So predominantly it's, well, self-funding isn't a good fit for us. And John kind of said it earlier, and I mean, the claims are going to drive it. And granted, are there better times to engage in self-funding than others? Yeah, typically when the house is not on fire is a pretty good time. It's smoother, it's a nice transition. But with that being said, when the house is on fire, I have also found that to be an ideal time. But you have to get off the spreadsheet. This isn't which carrier is going to give us the lowest price to mitigate that risk. It's which vendors allow me the best opportunity to get my arms around that risk and manage it effectively for the remainder of the year. So 2 examples. We have one going on right now where we locally up in the Ohio area with you all were able to reach out to the advisor, the employer, begin to understand a little bit more what was going on around this individual member. And then even we were able to reach out to some local within the provider community and engage them directly, and ultimately got to a spot where the initial concerns that the employer had of this actually turned into positives. They began to understand the risk better and not only recognized what it was, but that they did have the ability to manage it. And had we not been looking at it from a self-funded perspective, they never would have gone through that exercise. Similarly, Ethan, who was on here a few minutes ago, he and I are working on a case specifically down in the Nashville area where it's a known member, really high drug utilization. This is a fully insured group, but what's interesting is they're a provider group. They understand the challenges of healthcare. And so we approached their leadership and basically said, do you want to have a strategic discussion? Or do you want to have more of a, how do you just mitigate the losses through spreadsheeting? And they said, no, we want to solve this problem. This is $500,000 a year. And with working closely with the advisor, identifying a couple of options, within literally days, we were able to take a $500,000 claim and turn it into about a $200,000 claim or even less. And so I think what that shows is it's a little bit of rolling up your sleeves, but you'll notice in that instance, it wasn't just me doing it, right? Or just one person. I had to reach out within my network of vendors that provide specific solutions to say, hey, here's my challenge. Can you help me? And the reality is in almost every question that time that comes up, the answer is yes. And here's 3 or 4 ideas. So great coordination with your partners can literally make hundreds of thousands of dollars of difference just like that.
John, what say you on the same subject?
I say Doug is spot on. Fully insured plans will never, ever stop reacting to market forces. Self-funded employers that work with independent TPAs can manage their plan like they manage the rest of their business. It's about putting pathways in place, plans in place, so that when a high cost claim happens, it doesn't cost as much. Right now, what happens is you get a renewal and it's blamed on the high cost claimants. With an independent administrator, you can put a plan in place so that when the cancer happens, when the surgery happens, when a high cost drug comes in, the odds of it costing less are significantly improved. And so although you'll never get away from high cost claimants, if you put the proper plans in place in advance, if you have the appropriate strategy in place, I promise you, and that's a strong word, that the high cost claims won't cost as much. And I see a lot of people that are on this call know exactly what I'm talking about.
Yep.
There are ways to cut MSK claims almost in half or more, high cost drugs in half or more, cancer claims, et cetera, et cetera, et cetera. You just got to know they exist, find the partners that can implement them smoothly and get it done. Today is the start. If you fail to plan, you plan to fail.
I like that. Well said. Well, and both of you, you know, what's interesting is I was listening to that too, because I'll oftentimes think about if it's a high claimant, is it a high claimant really because they're allowed to go wherever they want to go without any knowledge or information about the cost and quality and outcomes of the place that they're going? And if someone is helping to navigate their care and coordinate their care, then there's a possibility that they could go have the same procedure done at a higher quality provider with better outcomes at a dramatically reduced cost. And so then that person who possibly was a high claimant may not be a high claimant had they gone to the right place at the right time. So think about that. And if you're, what we're talking about a difference of is right now, if you're in the world that we've talked about in a fully insured or carrier environment, you're passively managing the plan. There's no reason for them to take action. What we're talking about is actively managing the plan. And when you actively manage anything, you take action and you do things to change the course.
Everything that we just said on this last thing right here are opportunities to give away free care to members, free drugs to members. That's how you enhance the plan by lowering cost. It is so possible. You just have to learn and partner with the right people.
Yep. It's all about opportunity, right? That is what we've learned, is that you do not have to be punitive in insurance. I love the delineation between healthcare and insurance, right? Trevor said that well. And I guess that's the question is, are you going to be an insurance broker or are you going to be a leader and lead your clients to, you know, just a better experience altogether? So this has been really fun today. I've enjoyed this.
That's great. So Megan, do we have anybody else that is raising their hand to jump on the floor, or any questions that we need to make sure to address in the last 5 minutes?
Yes, we do. I just brought Dan into the pit and he had a question. And then we also have Nathan on the call. I think Nathan's just on audio. So Nathan, if you want to unmute yourself after Dan collaborates, you're more than welcome to talk live with everyone as well.
You know, this has been awesome. The emphasis on leadership is so important. One of the things, the advisor, you have to understand, you're now the quarterback of the team, and who you're talking to today with people like Doug and WellNet, et cetera, they're your linemen. They're there, and you're not going to be successful if you don't bring them to the team and use them appropriately. You're going to get sacked. You'll never score a point. Okay, and you'll lose the game. I guarantee you. You know, I live in Kansas City. We know what happened to Patrick Mahomes, you know, last year in the Super Bowl. And he's a great quarterback, but he got sacked. I mean, at the end of the day, lost the game, right? So the essence of where this is going in the marketplace is you as producers need to focus on being the quarterback, build your team. People like WellNet are going to be more than happy to do that. Your value proposition is reducing costs. I'm going to tell you one quick story from yesterday. We sat with a client and we looked at all the claims that they had over $100,000. There was one provider in that list that was charging 1,800% of Medicare. And guess what the CFO looked at and said, oh my gosh, what do we have to do to keep people from going to that provider? Okay, one simple thing. Now, here's the genesis, and John talked about it very specifically. This is a time process. It has taken this client 3 years to get to the place where we had the data that we could actually look at it and make that assessment and analysis. So it's a process. You not only have to be the quarterback of the team, but you build the team and go back to the same game. You're going to play the same teams over and over and over again. But if you win more games than you lose, hey, you're going to be a superstar. But you got to bring the team. If there's anything different going on today as a broker, in my age, and I've been doing this for 5 decades, the broker was the senior center point of everything that happened. Today, you're not. You have to bring a team. And if you don't bring a team, you will lose the game, guaranteed. Thank you.
Dan, that was awesome. Thank you. Appreciate the support and appreciate what you said. You clearly are a leader. So thank you. That was awesome. Megan, did you say someone else had a comment? Was it Nathan?
Yeah, we had Nathan raise his hand.
Yeah, can you guys hear me?
Yep.
Yes.
All right,
Yeah.
first off, I want to apologize if you hear a crying baby. Remote life, got a 2-month-old and a 3-year-old, so it's crazy. It's why I'm not on video. This is really informative. This is great. I want to be honest, I am not a broker or an advisor at all. I'm an accountant and data analyst by trade and a veteran. And I got into healthcare out of pure frustration. I hate our system.
Yep.
I was actually trying to bring a health plan proposal to my prior company, 250 plus employees, fully insured. So my proposal was to bring them to a broker that would take them to self-funding. Because if you're fully insured, you are paying max healthcare spend no matter what, and there's nothing you can do about it. And then I wanted to make the foundation direct primary care because based on the fundamental incentive level, it's the only player in healthcare where they are fundamentally aligned with the employer to lower healthcare spend and to focus on the patient's long-term preventive health. The only provider that will do that. And in the process of vetting direct primary care networks and clinics, I was actually hired on by one of them. They're impressed with what I did. So I've been the last 6 months just trying to network with advisors and employers and kind of talk about and educate everyone on what DPC is. And based on what Doug and John and everybody else is saying is, I think you guys are at that point with the price transparency data, which I'm happy to show anybody how to access that. I'm a data analyst. I have it at my fingertips. You guys have so much potential to start moving employers to self-funding, even at 50 employees. Yep. Captives are amazing. That's a future, I believe, and direct contracting is the future. So with a 10% fraud rate in our healthcare fee-for-service world, and up to 50% of all our healthcare dollars being considered fraud, waste, or abuse per CMS, the potential for savings is massive. Mm-hmm. So John, talking about risk mitigation strategies. The ideal risk mitigation strategy is to avoid that environment as much as possible. So direct contracting and DBC as the foundation is the ultimate hedge against claims. So that's my comment. And then my question is, how do you advisors best go about networking with vendors such as myself? This is my first time doing business development, so this is new to me. How do you go about building relationships with vendors? And how are you guys getting exposed to direct contracting and direct primary care specifically? Thank you.
And who wants to take it first?
Yeah, that was a
Team-
question for advisors, I heard. So maybe we open the floor.
Yeah.
The floor to
Team,
respond.
we are at time. If we want to keep going, we can keep the floor open and keep rocking and rolling. I just do want to be respectful of everyone's time. But Doug, Dave, and John, if you're still wound up, let's do it.
Yeah, no, that's good. I'll
You know
take
what?
the
There's
direct
questions out there.
contracting.
I'm good.
Yeah.
Let's go for it.
Yeah, I'll take the direct contracting part just because that's specifically what Health to Business does, right? That is really the core foundation of our organization. And I couldn't agree with you more. We have found that, it's not so much just what the contract or the network rates are, but it's just how you participate in that. And just by implementing a direct contract, you actually gain a tremendous amount of efficiencies, even if it was the same reimbursement schedule as you had on a network. So there are some real efficiencies to be gained there. And I will admit that up to this point in the market space, there has been a lacking component of connectivity within direct contracting, meaning it's each plan, each provider, and they're always one-offs. I will tell you that, we specifically are one of the organizations in the country that's beginning to, broaden our scope across the whole area to hopefully bring direct contracting to many communities. And we're even beginning to devise our platform so that it's going to be open access for anybody else that has contracts that would be interested in putting it on there, so that we can almost create somewhat of a network. So I think as the future goes, we're going to be able to leverage kind of these advancements of direct contracting much, much more. Maybe John or Dave, you guys want to take the question about how best to, maybe network within our industry, which is always fun.
Go for it, John.
I was going to say you go for it.
Okay. Well, certainly I think that things like this, there's so many different ways to, I'm going to pause for a second, because our marketing maven, this is what she lives and breathes, is thinking about what you do in order to kind of create connections and create relationships that help do exactly what we do. So Megan, what are your thoughts on this? I'm gonna pull you in.
Oh man. My recommendation is just really kind of leading with thought leadership and authority, and bringing in the right voices and right information to go to market and educate. I think that's the most, I think that's where we start in anything, in introducing these new concepts, to really get the employer buy-in, and then really talk about the value to the end user, which is the employee.
Yeah, good stuff. I knew you'd have a good reply to that. Yeah, and the other thing I would say is that sometimes when you go to TPAs like a WellNet that's been around now almost 3 decades, we've spent a lot of time also vetting who are the companies that are best at what they do, like Health to Business. And then we partner with those kind of companies to deliver cost containment solutions and things to drive down the cost of care. But we have leaders bringing to us ideas and thoughts all the time, and that we oftentimes are implementing those because they're in the greater benefit of not only that client, but our whole block of business. And so sometimes you can find independent TPA solutions that have done that, spent their time vetting the market, and have the right kind of partners in place. So then you've just got a turnkey solution. In fact, that's why most people come to us, is they say, I don't have to vet all these people. You've already got them. So that's another way too. But I would encourage all of you to attend things just like this, and let us know your feedback. Was this helpful? Was it not? Would you like to see this kind of thing again? Because this is what we're trying to do, is we're trying to change the face of the healthcare industry, because it is broken. But there are solutions out there to fix and repair and make it work correctly. And many partners out there have those solutions. So any last parting thoughts, John or Doug, before we let this audience go?
I'd say let us help you. We kind of talked about that. We're all experts in some way. And I think it was Dan that was on video that said, respect that a team is stronger than a person. I think that's today more valuable than ever. So surround yourself with people that are smarter than you, and you'll find you'll be far more successful than you've ever been.
Maybe my last piece would be this: is don't be afraid to ask for help. I think that one thing I've noticed as I transitioned a decade or so ago away from fully insured into this kind of unbundled, self-funded world is everybody pays it forward. And, often I've had people, say to me, why do you take the time to help? Why did you jump on a phone call with my client to speak to your experience? Why did you even share your clients, your references with them? And I think it's because people did that for me. And why? Probably because there's not enough of us out there, right? And I think that most of us on this phone call would realize that we're the minority out there of the advisors, brokers, agents in particular. But it takes a lot of us coming together to ultimately even make this thing move a little bit. And so I'm always selfless in that. And if you've got something to share with somebody else, I would encourage you to do the same. It's one of the reasons why we've partnered with WellNet, because we work so well in what we believe is an education process when we're engaging with advisors and employers. And so certainly I invite you to reach out to me. I'm always an open book, want to help people that want to get better. And I just want to thank WellNet for the opportunity to come on today. You guys have been a great partner, and just getting to share some of our experiences together. This was just a really neat experience today. I appreciate it.
Oh, that's so nice. Thank you, Doug. We're thankful to have a relationship with you as well, because you get it, and we like that. And so I wanted to say just to everyone that joined today, hopefully you got something out of this, and hopefully it got you pumped up to think about how you might have different conversations, how you can press reset and say, you know what, I'm going to change my talk track because I like what I heard from that person or that person today. And so that's what we're looking for, is just to really kind of help you as our partners and as our leaders in this industry think differently and do what's right and in the best interest of your client. So thank you so much for joining today. I hope you got motivated for during the course of this pep rally, and that you have a great renewal season, and we look forward to working with you. Have a great afternoon, everyone. Thanks again.
Thanks.
Bye.